We've heard it. It's true. Recording is on. I will be sending you an email after this presentation that actually has this recording, the PowerPoint notes that I'm sharing. So if you don't want to take tons and tons of notes, you're welcome to utilize this PowerPoint in an email that I'll send afterwards. There'll be a survey in there about this presentation. And one thing that will happen is after we introduce ourselves, we are going to turn our cameras off so that it helps with like the capability of sharing videos and our bandwidth capabilities. So we will turn our cameras off during the presentation, but we will not, we will turn them back on at the end, and we'll be gladly answer questions. So I mentioned before, if you're just joining us, to please use the chat function to ask questions. If we don't see that and aren't able to answer it during the presentation, we'll circle back and answer those questions at the end. We're so happy to have you here today. We are in partnership with the Georgia Department of Health, and specifically the West Central Health District and Georgia Strong Families. We're so excited about this partnership and their support to make sure that all expectant parents have kick counting information. And so we are going to present on Count the Kicks today. And I will just go ahead and change slides here, hopefully. Doesn't seem to want to do it. There we go. My name is Jen Rowry, and I am the Director of Advocacy and Engagement for Healthy Birthday, Inc., which is the nonprofit that runs the public health campaign, Count the Kicks. And I have been with the organization for nearly 4 years. My background is in education. I have a strong passion for providing knowledge. I believe knowledge is power, and making sure that women and pregnant people, birthing people, have the information they need to have a healthy birth outcome. And so I have lots and lots of great information that Erica and I are going to share with you today. And so I'm just going to let Erica take it from there.
Hi, everybody. Thanks, Jen, and thanks to all of you for being here today. I'm Erica Aiken. I'm the Georgia ambassador for Count the Kicks, and I've been volunteering for Count the Kicks organization for over 1.5 years now. I'm also a mom of 3. My daughter, Josie, is 5 years old, and my son, Calvin, is 17 months old. I'm here talking with you today, unfortunately, because my middle child, Alexandra Mary, was stillborn in October of 2019. It was the most heart-wrenching experience of my whole life. I didn't know the true meaning of the word devastated until I lost my sweet daughter. My pregnancy with Alex was completely normal, routine, and uncomplicated. There were no red flags, no causes for concern. We were both perfectly healthy. Well into my 3rd trimester, around 33 weeks, I stopped feeling Alex move. So I went in to see my doctor. And as I sat on that ultrasound table looking up at the screen of my perfect little daughter, I could see there was no heartbeat. There was no movement. She was gone. I was helpless, and noises emanated from my body I didn't even know I was capable of making. I then spent 20 hours laboring and giving birth to her. And after she was delivered, it was obvious the cause of her death was a true knot in her umbilical cord. It tightened all the way, and she didn't survive. So when I tell you that losing Alex broke me, a part of me was stolen that day. My heart, my family will never be the same or whole without her here with us. So I didn't know a whole lot about movement tracking. I hadn't done kick counting in either of my first 2 pregnancies. So in researching, how could this happen? What could I have done to prevent it? In retrospect, I do believe her movement pattern slowed in the days and weeks leading up to her death. So I don't blame myself, but I do wish I'd been better educated. I often wonder if I'd known about the importance of movement tracking, she might be here today. And that's something I have to live with for the rest of my life. So after I lost her, I did become educated on kick counting and the vital need to track movement of your baby during the 3rd trimester of pregnancy. I was really fortunate to get pregnant very quickly after we lost Alex with my son Cal, and you better believe I used the Count the Kicks app religiously during my pregnancy with him. So in a nutshell, that is my story. That's why I'm here today. I advocate for Count the Kicks on behalf of my precious daughter, Alex.
Erica, thank you for sharing the story.
Sorry, I can't get through it without, it's just hard.
No apologies necessary. Understand. So we will go ahead and proceed into the presentation, and Eric and I are going to shut off our videos at this time. So we're going to start our presentation today, our webinar, with a short video. It is from Good Morning America. We were able to save a baby in Iowa, and the mom, Emily Ecoff, does a great job of explaining what she noticed and how she advocated for herself. The other thing I love about this feel-good video is that it shows us about more information about the Count the Kicks app, which you're going to learn about today. I also would cue you into listening to the warning signs that Emily shares, what she noticed as being different. And finally, we know that mom-to-mom sharing is vital. Women share, or pregnant people, birthing people share information with one another, this shared experience, this lived experience. And so after this story aired, we know of at least 2, if not more, direct baby saves, babies that were saved because moms knew to track movement and speak up after they got their baby here. So that's why we're showing it today. I'll go ahead and get it started.
Hey, Jen, it is really hard to hear that.
I'm so sorry that it's too quiet. We will just move on, but it really does highlight the Count the Kicks app, which we are going to talk about today. So my apologies that the video sound is not loud enough today. I'm not sure how to get it louder. So let's move on to what is Count the Kicks, which is why you're here today, and we're so grateful for that. Many of you have the same desire as we do. Your desire is to get babies here safely, to support pregnant people and to get babies here safely. That's exactly what Count the Kicks is. Count the Kicks is a highly effective, evidence-based stillbirth prevention campaign. We developed an early warning system for moms, and we saved 1 in 3 at-risk babies in Iowa. Our campaign is ready to go and low cost. So before we get too far in this, I always like to highlight that we're talking apples to apples, that we're talking about stillbirth. In the United States of America, this can be different from country to country, but in the United States of America, the definition of stillbirth is the loss of a baby after 20 weeks of pregnancy. So an early stillbirth would be in that 20 to 27 week or second trimester. A late stillbirth occurs between 28 and 36 weeks, and a term stillbirth occurs between 37 or more completed weeks, which actually the risk of stillbirth increases towards the end of pregnancy. Our campaign specifically is focused on that late to term stillbirth prevention. In this country, I think it's important to know there is a silent epidemic of loss. Stillbirth occurs we lose over 23,000 babies a year. That means that if we were to fill a school bus with 65 children a day, and that's what we're losing, is a school bus full of children a day. That is not something that our country talks enough about. And that's another reason we're here today, is to shine a light on this problem. We know if there's a problem that we can help find solutions if we recognize and acknowledge that. The difference between a miscarriage and a stillbirth is just the timing of loss. Before the 20th week is a miscarriage. And in this country, infant mortality is if a baby takes their first breath till their first birthday and are lost. That's part of the infant mortality numbers. And we talk a lot about infant mortality in this country, as we absolutely should, but we also need to be talking about stillbirth, because there are ways to prevent preventable stillbirths, and we want to be a part of that solution today. So moving forward, you can see here that we actually lose more babies annually in the United States to stillbirth than we do to infant death. A lot of these facts and figures, they're going to be cited at the bottom of the slides. If you are somebody that wants to dive deeper into data, statistics, research, please know that throughout this presentation, there will be live links that will be shared and emailed with you. but most of the numbers we get are from the CDC. And so that is the link that is on the bottom of this slide in particular. So stillbirth by the numbers, like I said, it is happening way more often than many people in this country realize. 1 in 169 pregnancies in this country actually ends in stillbirth. If you really think about that number, 1 in 169, that is way, way too prevalent. Sadly, and probably not surprisingly, racial disparities do persist and exist within stillbirth and in alarming rates. For Black moms, that number is 1 in 96. For Hispanic, that's 1 in 199. For American Indians, 1 in 138. White moms, 1 in 204. Asian Pacific Islanders, 1 in 233. And we just want to highlight that this is an phenomenon that's happening at 10 times the rate that we lose a baby to SIDS. We would love to be like the Back to Sleep campaign. Moms that bring babies home are educated on sleep positions and safe sleep, and that is saving babies. And so we simply would love for stillbirth to be something that is not only talked about, but prevented in this country. And we believe that Count the Kicks can be part of that solution. So Georgia numbers, I think that's really important. We're talking about your state today. And if we look at these numbers, they are alarming. If we read the first line there, based on the most recent 5-year average, the stillbirth rate in Georgia is 8.2 per 1,000 births. That is, as you can see in the chart there at the bottom or right below that is the US is the blue line. So that is the average stillbirth rate in the United States per year. And then you see above that, the red line is Georgia. We have highlighted that the yellow line is Iowa. As we mentioned, we believe we can save 1 in 3 at-risk babies from preventable stillbirth by educating moms on tracking fetal movement in the 3rd trimester and empowering them to speak up and get those babies here safely if there is problems. So it's a non-invasive way for moms to have a data download of their intuition, a way to track that. If we were to save 1 in 3 at-risk babies in Georgia, that's 333 lives a year that could be saved. Right now, Georgia's losing over 1,000 babies, 1,041 babies on average a year. And we just want to see that change. And I have no doubt that everyone on this webinar wants to be a part of changing that number. So talking about Iowa, so we do look at trends. The red line is the US rate, the blue dots are the Iowa stillbirth rate. So our campaign started in Iowa. It was founded by 5 women who lost babies to stillbirth or infant mortality and had hard questions that didn't have good answers. And they were a part of getting a stillbirth registry here in Iowa. If you aren't tracking what the problem is or don't know why you're losing babies, it's hard to provide solutions or answers. And so they passed the first stillbirth registry in the country here in Iowa as their first action. And then they went to a presentation at a conference and that led to the birth of the Count the Kicks campaign. Since 2008, when Count the Kicks started, you can see a downward trend in our numbers. There are outlier years, things like pandemics and in a small birthing state like Iowa, a syphilis outbreak in a community, et cetera, can really impact those numbers. And so you do see there are outlier years that are good and lower than that trend line, a lot of them. And then there are a couple of outlier years where they're a little bit higher as well. So we have seen that 32% reduction in Iowa. And the health department here in Iowa says 100% they believe in our campaign and they're a part of that information. And this data was provided by IDPH. Going back to that disparities, why are there such large disparities in stillbirth? I think that the answer is the same for all of the issues that we see in health today, not just with stillbirth. Some of these are not going to be shocking to any of us. There is systemic racism in our culture that does lead to those disparities and the toxic stress that is created from that. definitely impacts women, as essentially being an African-American woman in a systemically unjust society has led to some real and pervasive health issues for those individuals. There is that like impact on your health when your environment is so stressful or you don't have the healthy environment you need. That can actually temporarily affect your DNA and change it to make you more predestined to certain health issues. And those health issues could be things like gestational diabetes, preeclampsia, and high blood pressure, which we know that Black pregnant people experience at higher rates. Access to healthcare and when you access the healthcare system can be a real issue, and the barriers of financial ability, socioeconomic barriers also create risk for individuals. Research has shown that education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. We can do better than this, and we need to do better than this. And so what is Count the Kicks focusing on? We do have a health equity coordinator on staff. She's an amazing woman. I hope you get to interact with at some point, named Stephanie Moody. And we are always looking for funding opportunities to specifically do the work to address these disparities that persist in stillbirth. We are an inclusive organization. We're 100% board and staff trained. We've had anti-oppression and structural racism conversations. We are constantly looking at how we operate internally so that we can also improve our programming externally. We do hold focus groups and really want to be listening to the lived experiences of women of color so that we can learn how to best support, come alongside, and provide the information they need in a way that they can use it. We work within marginalized communities. We have our Count the Kicks app in 14 languages. All of our educational materials have been reviewed and continue to be reviewed for their cultural appropriateness. We have videos, printed educational materials, and FAQs in multiple languages. So we're always trying to knock down barriers. How can we knock down a barrier if it exists? And part of that is self-analyzing. Are we part of the barrier? Are we creating that? And so we are constantly, like I said, looking to find partnerships, organizations that are already doing the great work, are trusted in communities. And so if you're a part of those types of organizations, we would love to have a relationship with you. You're already trusted, you're already doing the good work. You know the people, you could make the difference and be that grassroots difference in a community. Where did the Count the Kicks campaign come from? It is research and evidence-based. It actually was born out of a study done in Norway, a research study done in Norway. And that research study essentially in the country of Norway educated women to track their baby's movement in the third trimester, to learn if their baby's movement pattern had changed, to speak up to their healthcare teams and providers, the people that were supporting them. On the flip side, those providers, those healthcare teams were educated as well to listen to those concerns and have and take action on those concerns, whatever the appropriate action is. When our two founding founders, Tiffin Yeaman and Janet Peterson, heard this presentation at a stillbirth conference, they said, that's it. That's what we want to do. Because many of them in their stories had noticed a change in their baby's movement, but were not educated to track that, to know what to do with that information, that it was important information to share. So they wanted to make sure that this study really launched them into the idea of Count the Kicks to make sure other expectant parents had the opportunity. They said, if we could even save one baby, it would make all the difference. Dr. Ruth Fretz still sits on our medical advisory board, and she is a Harvard professor. She was a part of this study, and she says, and I love this quote by Dr. Fretz, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated to get to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And so that's why we're here today, is to provide that education, these tools, these resources, to get those in the hands of providers and to get those in the hands of expectant parents, and to create that important dialogue so that expectant people and providers can get these babies here safely. So Count the Kicks was named a best practice by the Association of Maternal Child Health Programs, AMCHIMP, and there was a thorough review to get that. And so we are excited to work with great organizations like AMCHIMP that have a national lens on improving all types of things for children and women. The CBC also lists baby's movement change as an important warning sign or an urgent warning sign. So we are educating women throughout this country through major organizations to pay attention to movement. That's something that hadn't been happening 10 years ago. And so, and the Hear Her campaign is relatively new as well. We are so excited to see more support throughout the country to provide this education. So one of the things we sometimes run into are barriers is that people are concerned that they're going to create anxiety in expectant parents, and that is not something that they want to do. So one of the potential side effects of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in a hospital. However, most research has not found this type of increase to be true. Usually fetal movement, or the FMC, is reassuring to pregnant women and prevents unnecessary visits. In fact, we did a big research study on our own app users and asked them lots of questions, and 84% of our app users stated that they actually felt a feeling of bonding, that 77% said it actually gave them less anxiety. And I think that Erica would tell you, especially in a high-risk pregnancy or after a loss, the need to have information and to track their baby's health actually created a lot less anxiety. It actually helped them deal with the anxiety that was created in that rainbow pregnancy. And that feeling of bonding, if nothing else, if a mom does not need this app to get her baby here safely, maybe she's one of the lucky ones like I was that did not have a crisis in my pregnancy, I still had the opportunity to bond with that baby. That's huge. Any prenatal bonding that can happen with baby can certainly improve the experience of mom and baby afterwards and reduce those ACEs that can create so many problems in society. So we would argue very vehemently, and the research information is on this slide, that kick counting does not increase anxiety in most pregnant women, that is not true. That is scientifically not true. Maternal fetal movement monitoring has additional benefits like bonding. I just mentioned that the reduction of preterm birth rate. For example, our executive director actually in her 30th week noticed a reduction in a change in her son's movement. Unbeknownst to her, her body was in preterm labor. What the warning sign to her, or the thing that triggered her to speak up to her doctor, is this change in movement, because she was educated to pay attention. She speaks up to her doctor, they check it out, they realize that she's in preterm labor, they're able to hospitalize her, give her the appropriate medicines and treatment to stop that labor. That sweet baby boy was born at 40 weeks, completely healthy. And it was movement that triggered mom to speak up, not labor pains, not anything else that she was noticing or recognizing. We know that fetal growth restriction is a risk factor for stillbirth, and we believe that we, through movement monitoring, can identify that earlier. Most of those babies that are growth restricted show many warning signs leading up to their demise. We also know, and we believe that we can be a part of the story or solution for maternal mortality in this country, which we know is at a rate that is unacceptable, because oftentimes we know mom and baby's health is tied. We know that when mom is expecting baby, mom and baby's health is tied. If mom's health is not good, baby's health is being impacted. Vice versa, if something's going wrong in the pregnancy, it can really impact mom's health. And so We just had a baby safe story out of Ohio where mom, unbeknownst to her, fourth baby, she was a nurse practitioner, had no history of high blood pressure, spiked an unbelievable high blood pressure. She did not know that that was what was happening, but she did know that her baby's movement had changed because she was using the Count the Kicks app. She spoke up. That in that scenario, mom's health was certainly the risk factor for stroke and severe issues existed. And so we think we also can be a solution to some of the health crises that are happening in moms. And we would love to help get moms and babies through this experience safely. There are tons of research articles. Our website is a plethora of information. I strongly encourage you to go to www.countthekicks.org and make sure to just explore all the information that's there. But there is all these links and research studies and things that we have available to you to look into things further for yourself. So the implementation of Count the Kicks, and this is where I stop talking and let Erica do the sharing. So Erica, go ahead.
Great, thanks, Jen. Okay, let's dive into what exactly Count the Kicks really is. It's a stillbirth prevention public health campaign that's evidence-based, but it's also mom-focused, and this is critical from a mom point of view. Count the Kicks educates women on importance of tracking fetal movement in your third trimester. You can use the mobile app, but we also have paper charts available for those who might not have a smart device. Count the Kicks empowers moms to speak up to providers if there's a concern in their pregnancy. So now let's talk about the Count the Kicks app itself. I think I mentioned to you, some of you might have joined late. I have 3 children. My second was stillborn. With my third, I did use the Count the Kicks app. And as Jen was saying earlier, I really do think that it is an opportunity to decrease anxiety in a pregnancy, especially if you've had a loss like me, or if you're high risk. It does give you that reassurance that your baby's moving as normal. So our app is available. It's free. It's available in 14 languages. The newest languages that we just added are Dari and Burmese, and we're always adding additional languages. It's available for Apple and Android devices. If you get interrupted during a kick counting session, you can restart your session, or you can delete a kick if you accidentally track one. If you get interrupted during a kick counting session, oh, I just said that. Sorry about that. We are all busy, and if you're anything like I was when I was pregnant, pregnancy brain is definitely a real thing. So you can set a daily reminder to help you to remember to count those kicks, and I will speak to that being extremely helpful. I think it's important to try to count around the same time each day, just for consistency. For me, the best time of day to count kicks was after dinner, when I would sit down and maybe watch a TV show with my husband. I found Calvin to be most active during those times. So having that daily reminder pop up so that I don't forget to do it was critical. And after a few days of tracking movement, you begin to see a pattern for your baby. You need to find out how long it takes them to get to 10 movements. And this is going to be different for every baby. And it's going to be different for every mom in each pregnancy. Some babies are a little more hyper in there and others might be slower. So this number and this time, it might take longer even in different pregnancies within the same mom. But the great thing about the app is that you can review your kick counting history. You can download it and share it with your provider so that you can discuss it at appointments. Your kick counting history can be useful for visits with your provider because it gives them evidence, of exactly what you're feeling. They can see it. And we all know providers like tangible scientific evidence. The app can also track future pregnancies. You do not have to create a new account with each pregnancy. You can manage your account on multiple devices. We recently added the Apple smartwatch as a device you're able to track through, which is great. And just remember, if you or your client does not have access to a mobile device, you can also do the same thing with the downloadable Count the Kicks chart, which you'll find on the Count the Kicks website. Count the Kicks now has a new strength tracking feature. Next slide, Jen.
Ryan here. Sorry, it's not.
So when I was using the app, this was a couple years back, and they did not have this feature. And this is something that I felt was definitely missing. And I'm so happy that Count the Kicks listened to the feedback and has since added this. Research shows expectant parents should also be paying attention to the strength of their baby's movements while counting and tracking their kicks. So with this new strength tracking feature, at the end of each session, a little note pops up and asks you to rate the strength of your baby's movements. If your baby's movements become weaker, that can also be a sign that your baby needs to be evaluated. So this new feature teaches us how to judge the strength of the baby's movement. You can rate your session from fluttery, which are light movements that are hard to see from the outside of mama's belly, all the way up to fierce. And fierce movement would be similar to what you feel when baby, similar to what is felt when you first started feeling baby move. Fierce is the strong movements where you can visibly see baby moving around through mom's belly. It can feel like a limb is literally going to poke out of your belly, a little alien baby inside. So at the end, you simply rate the strength of your kick from fluttery, which is indicated by 1 footprint, up to fierce, which is 5 footprints. You can also add a note detailing how your session went and what you might have noticed during the session. This note just said, baby felt strong like normal. Once you finalize the session, you get to see a graph. It shows the strength average of your baby as well as time that it takes for baby to get to those 10 kicks. So if a mama were to notice a significant increase in the average time it's taking baby to get to those 10 movements, or a decrease in the strength of their baby's movements, that would be an indicator that they should contact their provider. Reduction in fetal movement can also signal anything from low amniotic fluid or a ruptured amniotic sac to a tangled umbilical cord. If your provider's office is closed, hospitals are open 24/7. They're ready to serve expectant parents. The risks of not speaking up far outweigh the consequences of not going in and getting your baby checked. So you should always encourage your patients to go in if they're worried. All right, the Count the Kicks app now has a new video capability to educate users. So if you click on the menu button on the side of the app, there's a whole lot of resources there, but if you click the one that says resources, it takes you to the Count the Kicks website, where you can find useful information, videos on how to count kicks, videos about baby save stories, videos about why we count kicks. We are excited to announce that we've recently launched a new resource on our app. In this resources section in the menu, users are able to access this website, healthybirthday.findhelp.com. And this directs app users to free or low-cost resources as we attempt to positively impact some of the social determinants of a healthy pregnancy. Users are able to enter their zip code and search for free and reduced cost services they need. Perhaps they're looking for Section 8 housing or local doulas or food banks in their area. The list on this website is constantly being updated, and we look to others to let us know if a service or organization is missing on the list. So if you notice there are some key organizations that you might think should be added, just let us know. Okay, Jen, are we gonna try to watch this video? I know we're having some issues with the sound right now.
The sound will not be great, but I do want to show the video, and I'll tell you why, because it will show you what this app looks like. And when she's using it, it'll actually give you a visual. And so I apologize again that the sound is not working as well as we like, and maybe this video will be a little bit better, but I do want you to see the app in motion. I strongly encourage each of you to download this app, have it on your phone, so you can show and educate others, learn about it yourself. That way you can answer questions, you can see exactly how it works. So this would be a great time during this video to not only learn about the app, but download it. And I think the Apple Watch that she's got on her wrist is also an awesome way to do hands-free kick counting for moms if they have that resource.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the third trimester of pregnancy, has a new feature to help you monitor your baby's movement. The new strength feature allows you to rate the strength of your baby's movement on a scale of 1 to 5, from fluttering to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies stroke, this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play App Store. It is a simple and non-invasive way to monitor your baby's well-being every day in the third trimester. Features include Kicks counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab. And the app will find how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the third trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So hopefully that gives you a good vision for how the app works. And I would love to again encourage you to download that app. So having the stillbirth conversation is really important. This is not a conversation that anyone wants to have. Stillbirth is not a happy topic. And you'll take note that that app is bright and cheery. This is meant to be an educational campaign that is not fear-based. It is fact-based. It is empowering. It is bright. It is the goal of our founders for it to be the best form of a campaign that it can be. And I think that that not being fear-based is a really wise idea, but it doesn't mean that we don't share stillbirth with others. And so Erica is going to share with us now more about having this important conversation with your clients and patients.
Yes, we'll just talk a little bit about how you can implement the Count the Kicks app and movement tracking into your practice. It's very easy to do. We've created everything you need to easily have the conversation with your parents. So we recommend that you start talking to your clients about movement tracking early on in the pregnancy, so they're prepared to start their movement tracking at 26 weeks if they're high risk or have experienced a prior loss, or 28 weeks for a normal typical pregnancy. It's so important to ask your client open-ended questions, not yes/no questions, like, is your baby moving? At my practice, they asked me every time I would go in, is your baby moving? Are you feeling movement? And I'd say yes, but that is not enough. We need to know frequency of movement and strength of movement, and if there's any changes in those things. So a good question to ask would be, how would you describe your baby's normal movement pattern? And you can talk about how to track the baby's movements, show them how to use the app, download the app with them. Share how movements are jabs, rolls, pushes, anything but hiccups counts as a movement that you track. You will learn your baby's normal over time to get to their 10 movements. With Calvin, my third pregnancy, it usually would take him about 10 to 15 minutes to get to those 10 movements, but every pregnancy and every baby is different. And another thing you can tell your patients is Count the Kicks is an opportunity to bond with your baby and track your health. When I was pregnant, I was at first really nervous to use the app. I was concerned it might cause me anxiety. And I'll be honest, the first few days it did, because I just didn't know what to expect. But a week into it, I realized with certainty that it actually was so reassuring to have this resource. I had never in my entire life been so anxious as I was in my pregnancy after stillbirth. And this app just was so reassuring. Cal would get to his 10 movements within the 10 to 15 minutes, and I'd feel better about everything and could take a deep breath. So it really is an opportunity to sit, bond with your baby, interact with your baby, and alleviate some of that anxiety you might have. So at the end of the day, you need to encourage mom to speak up if she notices a change or if her gut instincts are telling her something is wrong. I've really learned to trust my gut so much since I lost Alexandra, because because mom knows. I mean, moms just know, but it's good to have the factual information, the evidence from the app to share with your provider. So encourage mom to go in, reach out to a provider if they notice a change in pregnancy, in the movement patterns, in the strength patterns. If you're not available for your patient, give her a backup contact. And if all else fails, mom needs to know it's okay to go to the ER if she ever has a concern about changes in her baby's movement pattern. It shouldn't matter what time of day, you should be proactive. Mom needs to go in if she notices an issue. We know and understand talking about stillbirth is not something anyone wants to do. I mean, it's sad, but it's so vitally important. And I just wish someone would have talked to me about stillbirth and prevention. Expectant moms hear all sorts of different things that can happen to their baby. We talk about the importance of taking vitamins and folic supplements, of not drinking alcohol. The conversation about stillbirth should be a routine part of an exam with your expected moms, just like vitamins and not drinking. So some things that we hear from providers when going through this is they might be scared of worrying mom. I don't want to scare moms. Pregnancy is full of risks. We know that. And we talk to them about the other risks. So stillbirth should be something they deserve to be educated about as well. Another thing we hear is stillbirth just happens. There's nothing we can do. Well, that's not necessarily true. There can be warning signs if moms know what to look for, namely changes in movement. Her baby's always active. It's not a concern. Babies are active until they aren't. Cord and placental accidents can be very sudden, and moms need to know what's normal so they can notice when a change happens. She's almost at her due date. The risk of stillbirth increases as moms approach or exceed their due date, especially after they go past their due date. So, a lot of times we get questions about what to do or say when talking about fetal movement monitoring with a woman who has experienced a stillbirth. I can tell you from personal experience that pregnancy after loss is very anxiety ridden. I'm a pretty laid back person in general, I would say. And with my first two pregnancies with Josie and with Alexandra, I was very relaxed about the pregnancy. I didn't worry. But after losing Alex, I realized that things happen in life that you just cannot plan for and are completely out of your control. So that feeling of loss of control, when I say I've never been more stressed in my whole life than the 9 months I was pregnant with my son, it is a fact. So having a sympathetic provider truly can make all the difference. I'm so fortunate. I had the same OB for all 3 of my pregnancies, and she held my hand every step of the way with my pregnancy with Cal. So I think in a nutshell, you should treat lost moms just like a normal patient. Don't make them feel like, there's something wrong with them. and don't be scared to talk about their baby. Say the baby's name. We want to honor our babies. And I think one of my greatest fears is that everyone's going to forget about Alexandra. So having a provider who will speak about Alex and help remember her with me, that's actually very reassuring. So going through these bullet points about talking to moms who have had a stillbirth previously, you can follow the same protocol, just have a conversation with them. We recommend that you read their chart before they enter the room. Since women who have had a stillbirth are more likely to experience another stillbirth statistically, it's a good idea to start talking about tracking babies' movements earlier. So at 26 weeks instead of 28 weeks in a typical pregnancy. You can feel free to talk about the previous stillbirth, as I was saying. Acknowledge their child was born still. Ask them about the name and the gender if you weren't their previous doctor. And please, please, please stay away from medical terms like fetal demise. I mean, that just sounds awful. You need to be empathetic. Your baby, Alexandra, use their name. They're a real person. They're not just a lost fetus. Ask if anyone has talked about the importance of tracking fetal movement before. A lot of moms we talk to say that they've had previous live births and they were never told about the importance of tracking fetal movement. So this is something that we should be having a discussion with any expectant parent, not just lost moms. Okay, I think Jen and I are going to go through some common myths with you. These are things that we hear all the time. So Jen, go
Yeah.
ahead.
Absolutely. So I'm going to go ahead and read the myth, and Erica's going to explain the answer. My baby is always active, so I don't need to count kicks.
False. Even active babies can experience distress. Sometimes it happens quickly and without other warning signs. Tracking your baby's movement every day takes the guesswork out of knowing if a normally active baby has slowed down. Count the kicks gives you real data to show your healthcare provider if you have a concern.
Only those experiencing a high-risk pregnancy should pay attention to their baby's movement.
Also false. I was not high risk and I lost my daughter. So all expectant women should be educated on count the kicks and get to know what's normal for their baby.
My baby should get 10 kicks in 2 hours.
Not true. Every baby's different, and the recommendation is to expect about 10 kicks in 2 hours. That's outdated. Current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements each day. And as I mentioned before, that number is going to vary from mom to mom and from pregnancy to pregnancy with an individual mom. All babies are different. So the time it takes to 10 might be 5 minutes for one baby, it might be 30 for another, it might be 45. It just depends. So we need to find what your normal is. And that's the number you're going for is your normal each tracking session.
There is more research on our website about this myth, the 10 and 2 myth, and why we have moved as a society, like medically, away from that type of terminology. And so one of the more recent studies actually talks about time and why putting time limits on things can be dangerous, where mom knows that that's not normal for her baby, but it took 1 hour and 58 minutes. So she does not share her concern with a doctor. It just time limits on human reaction to something. It's just not a wise system. I can just use a Doppler device to monitor my baby's well-being.
We hear this one a lot, and that is false. A change in the baby's heartbeat is one of the last things that occurs when a baby's in distress. A change in movement may indicate earlier potential problems before you notice a change in the heart rate. Expectant parents should only use a Doppler device under the guidance of a healthcare provider. And another thing is, where are they getting these Doppler devices? Are they ordering it on Amazon? I mean, we don't know how accurate the technology mom is using it. They also haven't been trained to use it. So really the best way for a mom to track their baby's well-being is movement tracking, not a Doppler device.
Baby isn't moving. I should drink cold water or eat something sugary to get baby moving.
False. Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like juice and candy. If a baby isn't moving like normal, parents should speak up to their provider right away.
Babies kick less near the end of pregnancy.
No, babies don't run out of room at the end of pregnancy. The types of the movement just may change. It is more cramped in there, but they're still moving. You just might feel more jabs and fewer rolling movements. But babies should move up to and even during labor. If an expectant parent is monitoring their baby's movement at the same time each day, it should take about the same amount of time to feel those 10 movements.
Triage doesn't need any count the kicks education.
Not true. Labor and delivery is the perfect place to have this information. Posters, brochures, discharge papers should all include information about kick counting when someone comes in for anything and is sent home.
Wonderful. So there are other ways that if we think systems change, like how can you in your for your clients and patients in the setting that you're in, because we have a variety of different individuals on this webinar today. So think about your system. Think about the way that you interact and serve and when you interact and serve. Although it's ideal to have the kick counting conversation before the 3rd trimester of pregnancy, if you have a one time to interact with that individual and it's in the 1st trimester, it's still important information to provide to them, an opportunity to share. But think about where you can put this information and how you can change the systems that you have in place to make sure that it doesn't get missed. Add it to your discharge paperwork if you have it. make sure all front desk staff is trained, and ask patients to fill out whatever forms you have, like intake forms or family care forms. The reason front office staff needs to be trained is because sometimes they're on the front lines. They're the ones answering the phone call and where a pregnant person is concerned, and they're sharing that concern. We don't want that message to get lost and returned 5 hours later. We want them to know that it's an important topic to be taking to a nurse or a doctor right away and making sure that advice is given. And so it's really important that the entire team is educated. Glucose testing, that's a perfect time when they're sitting there to have them download the app. It is before the 3rd trimester, but it gives that opportunity where they're a captive audience, so to speak, to give that information to pregnant people. Give them the brochure, encourage them to download the app with the time that they have, get to be knowledgeable on the app before they actually need to start implementing kick counting. EMRs, and so your medical records, if you have some kind of tracking system, where can this go in so that every appointment in the 3rd trimester, this conversation happens? It shouldn't be a one and done conversation in a provider's office. It should be a conversation that happens each time the expectant person comes into an exam room in the 3rd trimester. And I can reiterate based on experiences that have been shared, lived experiences from my wonderful ambassador team, people like Erica. They definitely want you to have this conversation. They definitely want to be told it's okay to speak up. The difference in a experience for an expectant person is giving them permission, not only educating them, but encouraging them to speak up if they have a concern.
Absolutely. I'm sorry to interrupt, Jen, but I just have to speak to that quickly, because I think having permission from a medical professional that it's okay to follow your instincts, to follow the data of the app and speak up if you notice a change is imperative. No patient wants to worry their doctor or be a burden, but it is important to trust that gut instinct and to trust the data. And if something changes, they should not be fearful to speak up. So I'm sorry to interrupt, but that is just really important to me.
Yeah, no, I think that is really important to all of us. And I think the other thing that's important to say here is that we don't actually see a higher incident of people running to their doctor. What the app does is actually, we noticed, 77% were less anxious. So Erica, without this tool, may have been more inclined, right, in her situation to be contacting her provider or going to labor and delivery on a really regular basis. What the app was doing for her was actually showing her CALS normal, and she was able to use that to work through that anxiety she was having.
Absolutely.
So I think it actually is opposite of what we think is going to happen, where there are going to be more phone calls. I think they're going to be more productive phone calls, because the conversation changes from, I feel like there's something different about my movement or my baby, and I have a worry, to I know, because this is how many times, or this is how long it takes my baby to get to their normal 10 movements, and it's changed. And now we have data. Let's talk about that. Those are real facts that mom can really bring to the table and help provider, because provider wants to support. We know everyone here wants to support mom. And so it just improves that conversation. It makes it easier to assess the situation. So examples of things that we are piloting. This is a form that could be used. We are piloting. If you're interested in using this in your practice or your setting, it is a very easy way for mom gets handed by the nurse or by the front office staff to answer these questions every appointment in the 3rd trimester. And there's a tear off that they can take home where they have the doctor's name. They know how to make that phone call. Where's the phone number? What do I need to do? They're thinking through that. It reminds them about the app. It asks them to write down questions if they have them. Sometimes that simple act of stopping and thinking in a doctor's appointment and having a moment to put that information down really enriches the conversations that need to happen. And so if you're interested in piloting this form, please do email us. Our emails will be shared in this presentation. And then I'll also be emailing you information, and you can respond to that email as well. Like we said, your EMRs, where can you where can you intersect count the kicks, right? So that the conversation doesn't get missed, that there actually is a record of those conversations. We do have a mom that is now a Count the Kicks ambassador that got her daughter Margot here exactly a year ago. She's a precious 1-year-old, and she says, I was very fortunate that my OB office shared the Count the Kicks information with me through posters on the room walls and a brochure, as it encouraged me to download and regularly use the Count the Kicks app, which is how I knew that my baby's normal movement pattern had changed. And that baby did get here safely because of the wonderful information that the provider was able to provide, and the conversation when she had a concern and addressing that concern got Margot here safely. Be a gold standard on your after visit summaries, your discharge paperwork. Add a section. Make sure that no mom that's had a concern doesn't have this information. Make sure as she leaves with it printed out, she's had the education she needs. So if she has further concerns, an ultrasound isn't good for a certain amount of time. Biomedical profile, things can happen quickly, things can change. So mom needs to know if she continues to have a concern, how to track that movement, how to speak up and to come back. It's better that a mom speaks up and gets a baby here safely than ignores her instincts and the opposite thing happens. Another example of a partnership we have with Celebrate One. This is an organization that gets one contact and opportunity with the individuals they serve. And so they put it in their intake form, Count the Kicks right there, something for them to know about, to provide that education and resource in the intake form. We do have additional great resources. This is almost turnkey. We've done a lot of the work. You just need to access it. So we do have additional resources in Georgia. Thanks to that amazing partnership with the Georgia Department of Health. We are so appreciative of their support. Erica is going to share some of those resources with you now.
Sorry, I was muted there. I was talking to myself. All right, I'm back. So I'm here in Georgia with you. We've got lots of resources available in Georgia. Our free app is obviously the hallmark tool to help educate and empower expectant parents to track their baby's movement. So we need to be encouraging patients to download that. However, our #1 resource for providers or organizations supporting expectant parents are the free Count the Kicks educational materials. These materials are free because of funding from the Georgia Department of Public Health and Georgia Strong Families. I'm really proud that these are now free to you guys, because this is something we worked really hard on last year, and I was a small part of making that happen. So please take advantage of these resources. It's the best possible tool you can use in your practice. They're ready to be ordered today. So we've got brochures, app cards, posters. They're available in both English and Spanish. You can hang them in your practice. You can hand out the cards. I have cards that I carry around in my wallet, and I am that crazy lady who, when I see a pregnant person out and about, I say, hey, have you heard about Count the Kicks? Here's a card, check it out. I think it's just an amazing resource, and we're so fortunate that we have access to that for free. So today we would love to see some orders happening for these free materials. So you can access the link to to get them shipped to you free of charge by scanning this QR code up on your screen. Or you can go to countthekicks.org and click on the Order Materials tab. And we're actually going to stop our presentation for a minute or two here. It's not done, don't go anywhere, but we want to give you an opportunity to place your order for Count the Kicks materials right now while you're thinking about it. And as an extra incentive, all individuals who place an order during this webinar or within an hour upon the webinar completion, you will have your name placed in a drawing for an Amazon gift card, $25. And who doesn't love some Amazon? So let's take a moment right now, and we're going to pause the presentation. I think Jen's going to play you a little happy music. And we would love for you to go ahead and scan that QR code or click the link to the website and order your materials right now. Is the song playing, Jen?
It is. I don't know that you can hear it well,
Well,
but
it's the happy song.
it is the happy song. And so when you go to order your materials, just go to that website, go to order materials tab and find the state of Georgia, which is free. Click on the state of Georgia and fill your cart and have them ship those materials shipped to you for free. We'll just give you another minute and a half here to do that. We are at the 12 o'clock hour. Don't go anywhere. We only have a couple minutes to finish up and we will be glad to answer questions. So good luck and happy ordering. We can't wait to send a gift card and we're so excited that you've joined us today and that these materials can come to you. So if you did place those orders, like we had indicated, you will get an email from Megan Ockett, my program director, and she will, or the director of programs here at Healthy Birthday, she will get that gift card to the winner. So we really hope that you do take advantage of this resource. These can go in libraries, they can go on bulletin boards across the community, they can be used in your practices and clinics. They really are meant to be empowering, educational, and everywhere. I think the goal is to have those and the opportunity to educate as many people as possible. So anywhere that this could, we know our Iowa Food Bank orders these and they distribute our brochures to expectant women that access the food pantry. So just be creative, think about the whole system and where you could utilize these types of resources.
And if you didn't have time to place your order right now, just a reminder, you have up to an hour after we conclude this presentation, which we're approaching the end right now, to place an order and you'll still be entered in that drawing for the $25 Amazon gift card. So other resources available to us in Georgia, we offer CE training. It counts as 1.5 credit hours. And the purpose of this educational activity is to train healthcare professionals on how to talk to their patients about fetal monitoring and using the best practices to track fetal monitoring. By using an evidence-based and non-invasive tool, providers can help prevent stillbirth. The low-cost training can be accessed via the link up on your screen.
Again, that link will be live when we send out this presentation via email in the next day.
Great. Other free resources include Parent Academy, Provider Academy, kick counting charts, which can be downloaded directly from the Count the Kicks website. They're available in English, Spanish, and Haitian Creole, and a plethora of videos on the website. You can also download a sample lesson plan for childbirth educators via our website. And another great resource to you are the Count the Kicks ambassadors, just like me. I'm the ambassador for Georgia, and there are women across the nation who, like myself, volunteer our time to work hard and share the Count the Kicks education and message through all of our state and each of their respective states. We're all volunteers. We can help with a variety of things, just like this presentation. Don't hesitate to reach out to the Count the Kicks ambassadors. And if you guys are here in Georgia with me, I'm your ambassador, I'm your girl. So please reach out to me. I want to be available to you guys, and I'm passionate about educating everybody about Count the Kicks. We also attend a variety of events like medical conferences, baby fairs. We can give media interviews. we really want to work to grow partnerships, fundraise, and more. So here is my info up on the screen. That's me. I'm Erica. You can email me at georgia.ambassador@countthekicks.org. And I'd love to connect with you on a personal level, share more about my story, share more about the importance of movement tracking. Really, guys, don't hesitate to reach out to me. I'd love to be a resource to you.
Wonderful. And Erica is passionate and she's wonderful. And we are so lucky to have her, and I'm so honored to work in Alexandra's memory.
Well, thanks, Jen.
Yeah, baby saves. So this is why we're here today, right? We want to make sure to prevent stillbirth, which really means when we're successful, that babies get here safely. Here are just a few faces, real live babies. We have well over 90 of these amazing stories on our website. These come to us completely organically. We do not get these from doctors' offices because of HIPAA rules and laws. We know there are hundreds, if not thousands, of these stories across the country today. I love this quote by Eva, a baby saved mom in Kansas. And she says, I am very grateful that Count the Kicks made me aware of the importance of paying close attention to babies' movements, and also that my provider took my concerns seriously and took action. I pray that my daughter stays healthy and continues to grow to become whoever her heart desires. I highly recommend the app to all expectant moms out there. Happy and healthy deliveries to everyone. Yelly Sarah. So next steps. We're at the end here. We're going to just do this last call to action. Familiarize yourself with the Count the Kicks app. Practice, practice, practice. Download that app, get to know it. Order those Count the Kicks materials. The clock is ticking if you want to get into that Amazon gift card drawing. That's how passionate we are about it. We know that it can make a difference for you and the people that you're serving. Take 3 to 5 minutes to educate your patients. Where are you incorporating this into your system? Make sure you're having that conversation at every touch point in the 3rd trimester. Make sure not only providers, but the entire staff. Think systemically. Anyone that interacts with that pregnant individual needs to be educated on how to respond to their concerns. Use those electronic health records, intake forms, update your discharge papers, etc., to include Count the Kicks so that your patients get this information in their hands and can apply it. And remember, hours and minutes do matter in preventing stillbirth, and that you can make a difference by educating your pet patients and expediting those conversations that need to happen. We are so thankful that you're here today learning. We hope that you will take this information into your communities, to your workplaces, to everyone that you work with and interact with, because it does make a difference. We have seen that in Iowa, saving babies here in a state that's very rural, which increases our risk factor, a state with higher obesity rates than the national average, a state with higher smoking rates than the national average. All are things that lend itself to higher stillbirth rates. Those are all risk factors. Yet we've seen, simply with this non-invasive campaign and that education and empowerment, babies being saved. And we would love to see that happen in Georgia as well. We are so grateful that you attended today. Eric and I will stay on and monitor the chat and answer any questions you may have. Please don't hesitate to ask them. You can also email either of us with questions or opportunities, thoughts. We are here to get the answers to those questions. If we don't have them, we'll find somebody who does. This is a campaign that is going nationwide, and we are so excited to know that we have the potential. If we saw a 32% reduction in this country in our national stillbirth rate, 32% reduction would mean 7,500 babies in this country could come home every year and live their futures with their families. And that is the goal of our campaign. Please feel free to pop questions in the chat. We are still here to answer those for you.
Jen, do you want to get back on video so everyone can see?
You know, I do, but it's not giving me that option there.
Well, here I am, guys, and I'd love to answer any questions you have. So if you have any questions, there's Jen.
Yeah.
Then feel free to ask your question via the chat, and we're going to hang on here for a few minutes and answer any questions people might have.
Just so you know, one question that did come in the chat that I was able to answer, but I want to answer out loud is, are people internationally able to download the app? Absolutely. Our app has been downloaded in over 140 countries across the world. And we actually have a couple amazing baby saves. We have baby saves in 3 countries, the UK, Canada, and Australia. Baby save stories on our website if you wanted to read those. So the app is free worldwide. We've had nearly 180,000 downloads, and it continues to be upgraded. Great people like Erica who used the app gave feedback on it, and that was one way that we made it better. And so we are always looking. We're always looking to improve that. Yeah, the recording will come to you. I had a question directly come to me. Yes, you can share that link via email, or you can play it for your staff. Certainly you can use this presentation to continue to educate others. That's very important to us. That's why we share our PowerPoint notes with you. We share it in a PDF so you can go back and access the information, answer questions, but also so that you can access that video. And if you would like to play it in a staff meeting, we would be honored for you to do that and continue to spread this awareness. Great question. Any other questions? We're here to answer those for you. We are so thankful for all of you that joined us today. We're so thankful for the partnership with the Georgia Department of Health funding this campaign so that you can get these materials for free. That app is completely free to women and pregnant people across the state of Georgia. And so we're trying to knock down as many barriers as possible. And remember, it's available in 14 languages. I know many of you work with different populations of people and are always looking for tools that could help break down language barriers. And so if you have languages that are really needed and necessary, please let us know that. We'll talk to the Department of Health. We would love to help you do the work that you're doing. Any further questions? We'd love to answer them if you have them. We're so grateful you hung on with us to the end today.
Yes, thank you guys for being here. It really means a lot that you care and that you're helping to save babies with us.
Yeah, it is a little bit late, so we do apologize for that, but we hope it was worth it. And again, my apologies on the videos. The links will be live in the, that when I send the email, so you'll be able to watch those videos live in the email that'll come out in the next day. Do we have any other questions? Can we have the handout sent to us? Yes, this PowerPoint will be sent to you in a PDF form. So yes, you will get it. Any last minute questions? We're here for just another minute or so.
And remember, go ahead and hop on and order those free Count the Kicks materials today so you can start distributing them.
Well, Erica, I can't thank you enough for sharing Alex with us today and sharing your story and your passion. You're such a difference maker and a change maker, and we're so grateful.
Thank you for all the hard work you do to educate women and providers in the world in general. You're an amazing woman, Jen.
You too, Erica. Okay, folks, if there are no other questions, I'm going to hit end, and I would love for all of you to place those orders and download that app and have a wonderful day in the great state of Georgia. Go Bulldogs, I think is the right thing to say. Not a
Go dogs. Go dogs.
Right? Okay, bye-bye.
All right, bye everyone.